That's why it tastes so good.
One breadstick at Olive Garden, 400 milligrams of salt.
Wow.
Now, not to say I like chain restaurants, but when you have heart failure, chain restaurants rule because they are legally obligated to put all of their salt on their websites. So before you go to Olive Garden, before you go to McDonald's, before you go to Applebee's, you can go pick your meal and know you're going to be safe. You're going to know if you get into trouble. Now, I, over the weekend, went camping, and we stopped off at Rosie's and had breakfast at Rosie. Delicious breakfast. Problem is that I have no clue how much salt's in there. So that's the problem. I love Rosie's, but unfortunately, you don't know how much salt's in there. So you have to say to yourself, I ate at a place I don't know how much salt's in it. Breakfast is yogurt and fruit. Dinner is vegetables and chicken to get me through the day. All right? And don't order the meatloaf. Don't order the lasagna. Don't order those types of things. When it's mystery meat, you have no clue what's in there. Sorry. All right, we talked about that. Avoid alcohol. You can drink alcohol, 1 drink for women, 2 for men each day. As a nurse, you have to qualify that answer because many patients will say, I have 2 beers a day, and you're like, sweet, you're doing great. Only to find out he's drinking 2 40s a day. That's a problem. So you got to ask the right questions. Physically active, we always say to our patients, I want you to be active. I don't want you on the couch. I want you walking, doing activity. All right? Sorry, pharmacy guys, to blow over this, but these are what we call the gold standard of medications. Now, there are some new ones coming out, but an ACE inhibitor, beta blockers, and diuretics. And I can come back, and you probably know our pharmacy group up there, and we can come back and do a whole thing about pharmacy. But anyway, key is take them. All right, 3 case studies, and we got questions. We're out of here. So, Mr. Smith is an 86-year-old admitted for shortness of breath, crackles in the lungs, and extreme fatigue with doing anything. His wife of 61 years died 2 months ago, and he currently lives alone. He's admitted due to a congestive heart failure, which he was diagnosed 3 years ago, and his EF is still 25%. What type of heart failure does he have?
Systolic.
Why?
Yeah.
Perfect. Left or right?
Left.
Crackles, good. During your assessment, what education do you think you should provide?
Definitely nutrition.
Why?
Why? He lives alone.
Okay. Yeah, his wife just died 2 months ago.
Right.
Is he hitting the 10 for 10 banquets? You know, that's what you want to ask. You know?
Activity level too.
Yeah. Good question. Yeah, that's perfect. All right. Mr. Jones is a 35-year-old independent contractor who was admitted for shortness of breath, extensive swelling up to his knees, 7-center JVD, BNP at 2100, and his chokes were positive at 2.22. Patient was found to have an EF of 20% and to have no blockages when cathed. Interesting.
Bill Nelson, please dial 8846. Bill Nelson, please dial 8846.
When assessing the patient, what things should you look for to see if his signs and symptoms are improving?
Measures JVD.
Yeah, so gone down. What are some other ones? Weight, yeah. Swelling, yeah. Great questions asked during assessment. Hey, how do you feel you're getting better? How do you know that? Is it right or left?
Right.
Right. Awesome. So knowing he had a clean calf and is young for his age, what would be an appropriate question to ask about his lifestyle?
Alcohol.
Alcohol and drugs, yeah. All right, last one, we're out of here. Ms. McClure called her PCP this morning as she was not feeling well. She described to the nurse that her BP over the last 3 days had been averaging about 180 over 110. She is becoming more short of breath with ambulation, could not sleep in bed, and has gained 5 pounds since yesterday morning. Yeah. Often we hear that. So, what type of heart failure do you think she has?
She's a little bit of both, isn't she?
Walk me through your thought process.
Well, she's having shortness of breath, and it could be in her lungs, but also she's gaining 5 pounds, and she could have swelling in her extremities.
So that you're talking left or right.
Yeah.
What about systolic or diastolic?
Oh, sorry.
No, I mean you're thinking the right way, but
Mhm.
think about from that standpoint. Is it systolic or diastolic? What was that?
It could be both.
There's one giveaway that it may be one more than the other.
The blood pressure.
The blood pressure. 180 over 110. So she's got hypertension. That might mean it's more diastolic than systolic. What lifestyle questions would you ask over the phone?
What does her typical day look like?
Mm-hmm. Now, Miss McClure, she's a sweet little lady. She's about 85 years old. Gets a little forgetful at times.
She's taking blood pressure meds.
Right. Have you missed any of your medications? What have you been eating lately? Oh, it's a big snowstorm outside, and I'm going through my cans of soup. Can't get out. So, those are good questions. So, you tell her, hey, come on into the doctor's office. What do you think the doctor will do prior to sending her to the ED?
EKG.
Not unrealistic, yeah, for sure. What do you think you could do from a medication standpoint?
Diuretic.
Yeah, maybe double her diuretic, make a diuretic change, you know, see what's going on with BP meds, do that assessment for her. But yeah. That's my nutshell. I kept you over about 10 minutes, so I apologize. Questions? Now, I'm going to throw it out here, and something we can talk more about, and you guys, this is your world, so I don't want to step on toes, but if there's things that you guys want to pursue from a pharmacy standpoint and learning more about the medications, I know that we have a whole pharmacy group up there. You guys do your thing. We're more than welcome to help and however. But that can, as you guys understand, become a very long conversation with a lot of ins and outs. I don't want to go too far down the road. I may have already stepped over my boundaries. Questions?
Do you have some written material for us to take home with us?
So I'm going to get Donna this, and I will also email her all of this. So this is a packet that a patient in our hospital, you guys, you know, we could all dress it up different ways, but your packet really does exactly the same as my packet does. You guys have this. You also have this really great booklet about understanding heart failure. Really well done. It's very similar to ours. We have this booklet here that has all of that content in it too, just designed a little differently for it. But I can send Donna all the tools we use, that fluid tracker tool we use at our hospital. We have a no-no sheet, so we give all of our patients a list of the no-no foods, the foods I really want you to stay away from. That's what we do.
I sometimes feel like when they're getting aggressive treatment and they're elderly and they have pretty advanced CHF, it's sometimes they'd be better off to just go home, you know, because it seems like they're so stressed when they're in the hospital, you know, and it's stressing their heart. And my brother has end-stage CHF, and he was told a year and 9 months ago that he had 3 months to live when he decided he didn't want to do treatment anymore. And he got better.
Yeah.
He went home and didn't go to the hospital anymore and just rested and kept his feet up, and he got better, you know. Sometimes I just wonder, you know.
I always say to patients, it's your choice. You guys can do what you want. For your brother, that seems like it's really worthwhile. For other patients, it's going home and just making one little tweak. Yeah. For everybody, it's a little
I
different.
mean, do you think stress is a factor?
Of course, because stress puts a burden on the heart. So, you know, you'll hear patients who get stressful who then go into AFib, and then that AFib causes that
Right.
spiral. So,
Right.
I
for
think-
stress.
I really think it's the way that we present. You have to. They don't have to do anything. If we can just tweak one or two things, it'll be better.
I
I think it's the way we present things.
Very true, and it's
And we're talking
really,
about the elderly, you know, the people who are approaching palliative care,
Yeah.
that kind of thing.
I always say to patients, you know, I'm here just to give you the information. I want to talk to you about that. But what are your goals? You know, do you want to come back here every 3 weeks? Do you want to come back here every couple of months? And everyone always says no. I go, so why don't we talk about what we can make minor tweaks with that may have really big benefits and go from there. But to your point, if we tell, we're not giving them the why, we're giving them the what, and that doesn't work.
I like your kit, I like that idea, so I think that would be something we can take back to Helen Porter.
Yeah.
It's a tool to go in and, you know, just do that.
Yeah. There is a wonderful video on YouTube that's completely free. We show it to all of our patients. It's called Heart Talk on YouTube. It's done by University of Connecticut. It's a doctor, it's got family members, it's got patients in it, and it's a really good way to start the teaching. So if you're a really busy nurse, you have a really rough day, give them the video. Then afterwards have a conversation. Hey, what did you learn? What kind of startled you? And that helps you. So oftentimes our nurses on our floor will start the conversation. Hey, I know the doctors just came in with heartburn. I want to show you a video about it, and then let's talk about it afterwards. And get some a lot of the key stuff.
I had a question, just the terminology. I guess it changed, like right after I finished my cardiac module. It went from something to now it's HF, yeah. So it's reserved and preserved ejection fraction, so does that correlate to systolic and diastolic?
Yeah.
Okay.
So preserved is
Diastolic? Is that,
exactly
okay, and systolic is,
reduced.
yeah,
Systolic.
cool, thanks.
Yeah. Give it 5 more years, it'll change.
Yeah, I'm sure it will.
But yeah, that's very true.
Okay.
All right. Thank you, Robert.
Thank you.